Just kidding. It's okay for most people to take off their masks. In the past year, one of the more distracting or frustrating aspects for the year of the COVID 19 pandemic was to mask or not to mask etiquette, and so on. Clearly, masks had a calming effect for many people, and in that regard, they were helpful. I make a distinction between science and science incorporated, which often seemed at odds. Many, many arguing different facts and pseudo facts to support their actions. Now that the wildfire of the pandemic is over and the risks of becoming ill while doing normal things are becoming much less than even in December of 2020, just a few short months ago, recalling a year ago with the message of 15 days to slow the spread and flatten the curve and these kind of things. The year-long weary battle to contain the virus, after all this, we're in a better place today. Understanding that the world faced a new foe, we can see how science was limited in how to react. But many well-funded studies have dissected and processed the necessity, and in some cases the impracticality of certain practices. In the case of masks, there are certain people and situations in which masking is not needed, except by preference, which one is always at liberty to express. In a recent study by the CDC, easily located on the CDC website, it's published March 12th of this year, it shows that masking only decreased after a mask mandate over the period of 100 days by a maximum of 1.9%. I'm sure you can't see this here. It's in my bibliography notes. But this information shows that mask wearing, even though it was often preached, really didn't affect the outcome very much. 1.9% decrease over 100 days. That doesn't seem quite worth the effort and the energy expended trying to get people to wear them. Maybe there's something better that we can do in the future. Other issues are that masks don't adequately protect the wearer. Sometimes people wear them improperly, and sometimes even properly worn masks can cause problems. Also, in a recently published CDC report, this study finds that of people who report often or always wearing a mask, 85% of these individuals also contracted COVID-19. So you could say that out of 100 COVID-19 patients, 15 of those reported not wearing a mask. 85 of them reported wearing one. So we're seeing that mask wearing alone isn't very helpful in containing the virus, protecting ourselves or each other. Individuals who have been vaccinated no longer need to mask. The CDC also recently released guidance for post-vaccination. The CDC made a statement that says you can gather indoors to a vaccinated person, an individual who has received both vaccinations or the entire course of vaccinations. You can gather indoors with unvaccinated people of any age from one other household, for example, visiting with relatives who all live together without masks or staying 6 feet apart, unless any of those people or anyone they live with has an increased risk for severe illness of COVID-19. So we're looking at people with comorbidities, morbidly obese, people with compromised immune systems should obviously be a little more cautious. However, if we've been vaccinated, this vaccine is safe, allegedly, we should be able to hug our loved ones, visit with each other, go to church, go to ball games, and really begin to enjoy our life as it once was. From experience, I know that masks can be really dirty after a little while. I hate to admit it, but I've shared masks. I find myself in a location that required a mask and I don't have one, so I'll grab one from the car. I'm sure no one else will admit to that, but that's the truth. That shares germs. That's not very safe. In any case, strengthening the immune system with a healthy lifestyle is a much better preventative. Many doctors will tell us this, common sense will tell us this, but to quote Dr. Catherine A. Bowling, who is a family physician at Mercy Medical Center, a balanced, nutritious diet, regular exercise, and getting enough sleep can go a long way to optimizing the immune system to fight off infection, whether it's the flu or something more serious. But these are things we've always known. We know these things. Wash our hands, sunlight, vitamin D. An observation I have made is that masking divided America overnight very easily by creating animus between two groups over a simple choice in which much of the data didn't have a clear picture. In the case of masks, it seems clear that they help to slow the COVID-19 spread only nominally beyond the sensation of proactivity. They really serve to turn one another against each other based on a common fear. This should be the lesson of the masks. The unifying principles to move beyond these past behaviors are, as always, respect for one another and the freedom to chart our own path. Thank you very much.